Welcome to the first of 3 presentations about mentation, one of the 4 M's in age-friendly care. In this presentation, we'll focus on the signs and symptoms of dementia and the important roles of daily caregiving in providing age-friendly care to older adults who may be experiencing dementia in nursing homes and other long-term care settings. As we have said before, daily caregivers make a big difference in the quality of life and living of older people in their care by using the age-friendly framework. There are many opportunities to talk with older adults as you provide assistance with daily cares. Talking about the person, their life, interests, and care preferences can help you learn what matters to them, and in turn, you can help the person do what is enjoyable or important. When daily caregivers focus on quality of life for residents, they greatly increase the chances of improving their own quality of work life. In so many different ways, what is good for the resident is also good for daily caregivers. Today, we're going to focus on dementia, which is a part of mentation, which is one of the 4 M's of being age-friendly. Mentation is a big word that mostly means mind or mental health. Dementia is important since it's both common in nursing home settings and causes loss of abilities that often combine and overlap to create changes in personality, emotion, behavior, and ability to function. Those changes too often interfere with a person's ability to talk about what matters most. How dementia affects the person depends on where he or she is in the course of the disease. As this picture shows, dementia is often a gradual loss of abilities over time. That means a caregiver shouldn't make assumptions about what the caregiver can or cannot do. Getting to know the person and his or her likes and dislikes, abilities and preferences may take more time, but it is important to keep trying. Talk, listen, ask questions, wait for an answer. It all helps to know the person and what matters most. Dementia can cause behavioral symptoms that are distressing to both the person and others around him or her. It's critically important that daily care providers understand that behaviors rarely come out of nowhere. Instead, they are a form of communication, the way the person with dementia tells us what they need, whether it's company or food or some quiet time. The point is that caregivers can learn to listen to the behavior and adjust their approach to help the person meet their needs and be comfortable. Many behaviors that are labeled as being problems are the results of unmet physical, emotional, or social needs. Taking a minute to think about common patterns can be very helpful in replacing negative behaviors with more positive and engaged behaviors. For example, what time of day does the behavior occur? Where does it occur? What is going on around the person? In short, daily caregivers can often reduce challenging behavior by meeting unmet needs and adding something pleasurable to do as an alternative. The age-friendly care framework has 2 main steps. First, ask yourself what might be going on that causes behaviors you don't understand. What might be the trigger? What happened before the behavior started? As the earlier slide noted, there are lots of triggers like hunger or pain, lack of privacy, or boredom. In short, there is a lot to consider, but unmet needs are often the cause. Next, act on your findings. What did you learn by thinking about the situation and what might be causing or contributing to challenging behaviors? What do your team members know or possibly do different? There are lots of ways to change what you do that makes a big difference in how the person with dementia responds. And as you listen with all your senses, you are learning what matters most to the person. Listening to both words and behavior is important to really knowing the person. Keep trying to engage them in conversation, even if what they say doesn't make perfect sense. Use your best communication skills to show you care. Make eye contact, speak in gentle tones, slow down, simplify your message or question. It all makes a difference in the outcome. And what is good for the person is also good for you as stress goes down. A big focus of being age-friendly is focusing on the person and what they can still do. Time spent talking with the person about pictures or personal items in their room, asking about their favorite activities or what might make this a great day for them helps you provide better care. You can support their personal preferences for daily care and help them to engage in activities that matter to them. Simple adjustments to support the person do what they can are important. Avoid the urge to take over and just get the job done. Instead, slow down, assist or cue, and listen for meaning, words, and actions. There are so many ways that daily caregivers make a big difference in quality of living for all residents, but particularly for persons living with dementia. Your contributions to knowing what matters help assure daily cares are provided in ways that fit the person's needs, for privacy or making choices that help them feel engaged. And involvement in enjoyable activities and avoiding situations that cause distress, like noisy or confusing settings, promotes comfort and function. In turn, risk of behavior is often reduced, and the quality of relationships between you and the person improves. In summary, the age-friendly framework helps daily care providers support older adults to do what matters most, including persons living with dementia. Stop and think about what the older person is doing or saying. Consider how losses associated with dementia might be influencing what you see. Focus on the person and being person-centered. Listen with all your senses, what is said, how it's said or sounds, what and when an action occurs, what might it mean, how does it relate to the person's needs, and what matters most to them. As always, work with your team to share information and problem solve together and support doing what matters most. Next, I hope you listen to the What Matters podcast to hear about how age-friendly care positively affects residents, caregivers, and even nursing professionals.